Afternoon, everyone. I am a strategic program director at Geisinger Health System, which is located in the states of Pennsylvania and New Jersey. And we have been working with Geisinger, with Merck and Geisinger to develop two applications that are Smart on FHIR enabled. And we've really leveraged the strengths of both of the organizations to the point now where we're conducting outcome studies that we hope to publish results on next year, as well as we're actively looking to sell both of these assets to a commercial partner. So if that interests you, please come see me this evening while we're drinking wine. But before we talk about the applications, especially because I know that we're at the end of the day, I like to play games and make it personal. Because when we were really thinking about what solutions we wanted to try and work on, we wanted to make it applicable at a national level, not just at Geisinger. So what I'd like all of you to do is close your eyes and let's imagine. So I see eyes open. Okay. So think of yourself as a mom or a dad whose 8-year-old son just got diagnosed with lymphoma. Think about yourself as a 50-year-old male whose mom just got diagnosed with Alzheimer's. Think of yourself as a son or daughter who lives 3 states away from your parents, and you want to actively be managing and helping to manage their care, but you're so far away that you really can't actively play a part. And so you can open your eyes now, and why I find this application so personal is because that's me. My That's Me started 8 years ago when I was diagnosed with breast cancer, about a year into my marriage, living life carefree, and all of a sudden you get told you have this crazy disease, you're 30 years old, and you have to have chemo, radiation, and surgery. And there's one other person on that screen who is now, I call this guy my husband, and he was part of that care team too, but a lot of times caregivers in America, and we know that the AARP tells us that there are about 65 million of them, get forgotten about. And so what we developed was what we call family caregiver application. And what this really focuses on is the digital divide that exists between the caregivers and the patients. You know, all the privacy and security regulations that we've developed over the years play a part, but it also creates a large barrier to involving those caregivers in what we typically call complex conditions, like the cancers, like the Alzheimer's, like the pediatric cases that I mentioned. So Merck and Geisinger decided to deploy or develop an application, and the test bed of patients that we used was stage 3-4 lung cancer patients. Because as most of you know, those are the patients that are typically going through multimodality treatment, chemo, radiation, and others, and we wanted a way to involve that caregiver. And so what we did was we developed this app using user focus groups that included caregivers, patients, providers. We've Smart on FHIR enabled that app, and we've integrated it into the workflow. We've iframed it into the Epic workstream because at the main campus at Geisinger, Epic is what we use. So to show you this application, the patient has to have access to My Geisinger, which is Geisinger's version of My Chart through Epic. And in that hyperlink, they click on Family Caregiver application, and it launches this patient login, which Compass is what Geisinger has developed to capture patient-reported data. So the patient sees this, they click on the Start button, and it takes them to our landing page, where, again, none of this is rocket science, but sometimes in science and healthcare, we get so excited about all this sexy, cool, flashy stuff that we forget about the really simplistic stuff that matters to the patients. So I'll walk you through each of these screens. The first one is our interest in information. So what we heard from our patients is, I want my oncologist to know that I like the Pittsburgh Steelers. Raise your hand. Wow, it's a hard crowd. I like the Pittsburgh Steelers, and when the Super Bowl is, I better feel good. Or my daughter's getting married in 3 months, and let's see if we can work my chemo and radiation schedule around that the best we can. Or my nephew is getting baptized, and it's really an easy thing for the patient to do. They click on those sections, they free text in, they can add pictures of that make it personal for that patient. So when the provider is walking into that room, that patient is more than just a number, they're a person. We also heard from patients that when we're talking about multimodality, especially at Geisinger, where we have med-onc appointments in Epic Beacon and rad-onc appointments in Varian Arian, and then we have patients that have Google and Outlook calendars, that there's so much information and so many appointments flying around that they really wanted to be able to see it all in one spot. And so what we created is what you see here, either the month or the week view, and it allows the patient to let the provider know that, hey, you know what, that purple that I'm sure is hard to read, but that purple says Zumba. Every Tuesday and Thursday, I go to Zumba at 8 a.m., so don't mess with my Zumba when you're scheduling my radiation. Then we wanted to let us know who their care partners are. So this is one lucky lady, because if you look at the top, Joe Caregiver's her son, but George Clooney is her brother-in-law. So there may be some special things that you need to have in place when he shows up that day. They told us they want to know who all these doctors are. So if any of you have ever sat through a multidisciplinary clinic when you're going through any type of complex condition, the doctors fly in and fly out 3-4 hours at a time. And it's really hard for these patients that are going through a very traumatic experience to remember who they are and what they are, even though they want to. So it's just something as simple as showing staff pictures what that provider's specialty is and what they're going to help them beat this disease with. Then they wanted us to help them look at their medications. And this list pulls directly from Epic. We use Metaspan as our database, and it's showing them their list of medications. But what they really wanted help with is creating a schedule. So this kind of puts paper into the process, because they wanted to say that they need to take meds A, B, or C at 9, 12, and 3, and the ability to print it out, put it on their kitchen counter, and help them manage their disease while they're going through, again, this very traumatic experience. And then finally, the patients and caregivers said, I want a way to electronically document, instead of the binder that's that thick or the 3-ring Mead notebook that they carry in, I want to electronically document that. And so all this is a free text way for the patients to do that, and they can share that information with their providers. Moving over to the provider side, again, this is iFriend right into the Epic workflow for the provider. They click on the hyperlink and it launches Geisinger's Compass landing page. And from here, the provider clicks the start button, and it's a pretty simplistic view of what the provider sees. On the left is the full screen, but a little closer up, it's really just a repeat of all the things I showed you on the patient side. Information about the patient, information about their care partners, their medication, activities, and appointments, and the patient can actually question their provider or send questions to their provider, not just within My Geisinger, but within Family Caregiver application as well, so that when the provider goes into the room, there's some leading questions that they're walking in there with to help with the efficiency of the visit, but also to kind of understand the mindset that patient's in going into that visit. So that's the first application. The second application is something that we call MedTrue. And so the That's Me is all these people that you see up here on the screen. So these are the people that I expect that I'll take care of, and I'm sure if you all think about if you have a spouse or a mom or a dad or an aunt or an uncle or a grandma or a grandpa that has a medication list that's 5, 10, 15, 20 medications deep that you either now or may one day need to help to manage, getting their med list right sounds like it's a really simple thing. But it's really, the data tells us that it's not, and that we really stink at it in healthcare. So when you look at the national level data, 80 to 90% of med lists are inaccurate. And when we at Geisinger, before this collaboration, did our own study with the NORC at Chicago, we saw that 80 to 90% of the med lists are accurate, and of that 70% of the time, pharmacists also said that, yeah, we agree, the patient's med list is inaccurate. So with that, we knew it was a pretty broad national health crisis, as we call it, that was not just impacting Geisinger, and we wanted to do something about it, giving all the money we know that gets wasted each year and all the incidents that happen. So what we did again was we worked with our providers and our patients to develop this solution that is a mobile responsive web app that again is integrated directly into Geisinger's EMR. And what it is it's going to be FHIR enabled. We're working on that right now to complete that. It's directly embedded into the provider's workflow, and the patient can look at their med list before their visit, or when they get into the clinic, we hand them an iPad. And also, because med lists don't just come from within one health system, they come from what the patient may be taking at home or also other health systems, we found it really important to integrate SureScripts as a data feed in our case. So let me show you this application. So the patient logs in through Compass again, and through My Geisinger, and they click on the hyperlink in My Geisinger, and it takes them to MedTrue. And they click the orange button to Let's Begin. And again, design is very, very simplistic. We worked with our UI and UX guys as well as an outside firm to come up with this design through many iterations. And I know it's hard to read, but those are the 5 medications that the patient has on the patient's Epic Med list at this time. And they'll go through and ask themselves, am I taking each one? And the last one at the end, repaglinide, the patient says, wait, my endocrinologist discontinued that. So all they do is click the remove button, and it lets their provider know that we want to take that off the med list. Doesn't take it off yet, but it lets them know. They can also add a medication. So the patient can say, hey, you know what, I'm taking that baby aspirin. They're not sure what the milligrams or the route, they're not just as medically inclined, so they just type in aspirin and they click the orange add medication button, and it adds that medication to their list in a pending state. Patient says, okay, I see all the meds that I'm taking. They click continue, and we remind the patient, are you sure you put in all your ointments, creams, things you're taking over the counter, because we know they're important as well to keep track on a med list. Patient says, yep, I'm finished. And the last thing we do is we ask the patient to self-report how often they're taking each of their meds. So they go through each one in this analog scale, 25%, and they click which percentage of the time they're taking it, 25 to 100. And at that point, the patient is done. So I'll flip over to the provider side. And on the provider side, again, I-framed into the Epic workflow. The provider clicks on the hyperlink, clicks start, and this is the provider dashboard all in one shot. So on the left-hand side, you see all of those medications that the patient said, hey, doctor, I don't think I take these, or I do take these, or the atorvastatin at the top that was added by SureScripts to the data feed. So the patient or the provider can click on the thumbs up, atorvastatin comes up, they add the route and frequency directly coming from our Epic Metaspan database. And after they do that, they click save, and it will move it over to the right-hand side. The same thing with repaglinide. The patient said, I'm not taking that anymore, take it off. Provider agrees, clicks the thumbs up. It asks us to enter a discontinuation reason. So we assimilate the Epic workflow that the provider would typically otherwise be doing. Enter the discontinuation reason, moves it over to be pending to be removed. And finally, aspirin. So all the patient typed is aspirin. The provider wants to add it. They can actually go back, search our Epic Metaspan database, find 81 milligram tab, add route and frequency, click the save button in the orange, and it adds it to the patient's med list on the right-hand side. At this point, all the information you see that's left are those columns on the right-hand side. And what that you're seeing there in the first column is the actual adherence rate, or the fill rate from SureScripts. So it's telling us how often is that patient filling the data versus adherence, which is the next column. So we're creating leading questions to have real meaningful dialogue with our patients. For example, the chlorthalidone. Well, I see you say you're taking it all the time, but the fill rate is only showing me 40%. What's going on? Well, doc, it's mail order pharmacy. It makes me go pee, and when I go out to eat, I don't have to run to the bathroom all the time. Oh, okay, that makes sense. Well, I see you say you're taking your metformin all the time, but the fill rate's only 40%. What's going on there? Well, I take it every day. Well, do you know that you're supposed to be taking it twice a day and 2 tabs? So it really allows us to have some real serious patient medication, patient education. And something we were actually just talking about yesterday is, as it relates to, what outcomes do we expect to see? We don't necessarily think that this is going to make it faster. we think that it's going to make it better. And so all of us that know that value-based care is where we need to be, this is the type of tool that we need to see integrated. And so that is what at Geisinger we're currently doing, and we're hoping to deploy across the country through the help of a partner organization. And let me just show you this. This is we've added a feature so our providers could feedback to us so they can enter information about how they want to see the application change or something's broken. And at the end in the top right corner, the provider clicks on the save to the EMR and it formally saves it to Epic. And so the provider does not have to go back into Epic in this specific function to do MedRec. And that is it. Thank you.